I'm Saransh Chaudhary from Venus Medicine Research Center, and today I'm going to be presenting you a study which shows VRP044, which is a novel reformulation of Colistin compared to the marketed Colistin, and we compare the nephrotoxicity and pharmacokinetics in rats. So in this study, the main goal was to look at a new formulation of Colistin, VRP044, to try and see whether the formulation has a toxicokinetic profile that is more favorable than the marketed formulation of Colistin. And in doing so, we looked at the pharmacokinetics of both drugs to see whether the reformulation is altering the pharmacokinetics in any meaningful way. And we also looked at a lot of biomarkers, both traditional biomarkers like serum creatinine and BUN, and also novel biomarkers such as KIM1 and cystatin C, which have been qualified by the US FDA for early detection of kidney injury. And the goal of the study was to essentially see whether during all of these assessments we can figure out whether the new formulation is any safer, and if yes, what is the safety margin that we expect. A secondary part of the objective of the study was also to assess whether the novel biomarkers are able to predict kidney injury before the traditional biomarkers of serum creatinine are able to do so. So for the methods of the study, we took 18 Sprague-Dawley rats and we divided them into 3 groups of 6 each. One was the control group, and then 2 treatment groups, one for VRP044 and one for the marketed Colistin. So as for the dosing, we chose a high dose of 36 mg per kg per day, divided in 3 doses of 12 mg per kg every 8 hours. For each dose, this corresponds to roughly a human equivalent dose of about 6 mg per kg per day. And we continued dosing for 2 days, so that's 6 doses in total. So for the pharmacokinetic evaluation, the blood samples were collected at multiple time points, and they were evaluated up to the pharmacokinetics were evaluated after the first dose and the 6th dose. The urine samples were also collected up to 48 hours, and the drug concentration in urine and blood samples were analyzed using validated LC-MS. For the toxicokinetic assessment, we used ELISA kits, and for the pathological assessment, we performed necropsy, and the histopathological assessment was performed using the EGTI grading system. So in the results, the first we have the pharmacokinetic data, and in the pharmacokinetic analysis, what we see is 2 graphs, figure 1A, which shows the pharmacokinetic assessment after the first dose, and figure 1B, which shows the pharmacokinetic data after the 6th dose. So across both of them, what we see is that there's a marginally higher AUC in the experimental group of VRP044, but broadly across both doses, both treatment groups follow the exact same pharmacokinetic profile, and the marginal increase in the AUC that was observed was not found to be statistically significant. Moving on to the biomarkers. Now, the novel biomarkers were measured in the urine, and they were normalized to urine creatinine, so they can be compared. The first graph here in figure 2 shows the data for KIM1, followed by cystatin C. So the top 2 graphs show data for the novel biomarkers, whereas the bottom 2 graphs show data for serum creatinine and BUN, which are traditional biomarkers. So across the novel biomarkers, what we see is that across both treatment groups, there is a rapid increase in 2 days for the biomarkers, and there is statistically significant increase across both KIM1 and cystatin C. However, notably, both of these biomarkers also suggest that the increase in the treatment group, in the experimental treatment, is still significantly lower than the increase in the marketed Colistin group. Also interestingly, what we see with the traditional biomarkers is that while in the marketed Colistin group across 2 days, there was a significant increase for both serum creatinine and BUN, the increase in VRP044 was not found to be statistically significant. Now, there are 2 things to possibly take away from here. One is that the novel biomarkers clearly seem to be much more sensitive in terms of being able to pick up nephrotoxicity much earlier than the traditional biomarkers. And it can also then be said that there is a signal that the novel treatment of VRP044 has some safety margin which reduces nephrotoxicity. This can now then also be verified in the histopathological assessment. So the histopathological grading for both, so figure 3a shows the histopathological grading for marketed colistin group, and figure 3b shows it for the experimental VRP044 group. And as I mentioned earlier, that we use the endothelial, glomerular, tubular, and interstitial scoring system, the EGTI scoring system, and the grade for the marketed colistin was a grade 3 damage, whereas for VRP044 it was classified to be a grade 1 damage. So this sort of validates what were the findings of the biomarkers as well. So in conclusion, what this study showed is that both formulations of VRP044 and colistin had a similar pharmacokinetic profile. So there's no changes in the pharmacokinetics in the reformulation. And it also showed that across all 4 tested biomarkers, there is some evidence that the new formulation reduces nephrotoxicity, and also shows that there might be potential for this new formulation to offer a slightly safer option for clinicians to treat colistin. And it supports the continued development of VRP044 for further assessment in more animal and eventually clinical studies. Thank you.